So my name's Andrew Nicholson. I am an assistant professor at McMaster in the Department of Psychiatry and Behavioral Neurosciences. Really the goal of this research project is to um, essentially train individuals with PTSD to self-regulate those functional connections in the brain so that we might reinstate and kind of normalize that aberrant functional brain connection. And what's very alarming is that during the COVID-19 pandemic, trauma exposure rates have really skyrocketed among healthcare workers who are affected by the psychological impact of the COVID-19 pandemic. And we know that up to actually 40% of individuals do not respond to currently available frontline treatments for post-traumatic stress disorder. So novel adjunctive treatments for PTSD are really in high demand, especially in light of this increased prevalence rate among frontline healthcare workers. So the kind of goal of this project is to develop a novel adjunctive treatment for individuals affected by post-traumatic stress disorder, particularly frontline healthcare workers who have been really affected by the psychological impact of COVID-19. I recently started my first academic appointment at McMaster University in the fall of 2020. This award is not only, benefiting myself and my research program, but is providing the opportunity for graduate students to be trained in medical biophysics, clinical assessments, brain imaging, machine learning, which will really benefit their careers moving forward as clinician scientists working to reduce the illness burden of post-traumatic stress disorder. I think we have a long way to go in terms of the interventions and treatments that we have for mental illness. And through grants like this, the Banting Discovery Award, it really, makes it possible to develop these novel interventions, but also how we can better understand mental illness and how we can, develop neurobiologically informed treatment interventions that really have a high success rate, because we know that the treatments that we currently have available, many people are not responding to that. We need a more personalized medicine approach. We need novel adjunctive treatments. And yeah, I think research grants like this really have the potential to make such a large impact given the current state of the field.